Cardiac amyloidosis is the deposition of an abnormal protein within the heart. It happens surreptitiously. It can happen without knowing what is happening, and the presence of this protein in the heart causes the heart muscles to become more stiff. This in turn leads to episodes of abnormal heart rhythm, episodes of recurrent heart failure without a reason, and eventually can lead to persistent heart failure and grow. It can result in cardiac arrhythmias, recurrent episodes and admissions for heart failure, and eventually a slow and gradually declining course of poor cardiac health resulting in cardiac death. Why it is important to know about cardiac amyloidosis is because currently the therapies that are available for this disease can only prevent further deposition of this protein into the heart muscle. They cannot prevent or decrease the amount of protein that is already present within the heart muscle. So early diagnosis is key. Early classification into the subtype of cardiac amyloidosis is very important because depending on the subtype, the treatment changes. Additionally, the commonest abnormal rhythm in a patient with cardiac amyloid remains to be atrial fibrillation. Atrial fibrillation is a challenging disease because it can cause stroke. In the presence of cardiac amyloid, one always needs to be on strong blood thinners to prevent a stroke. So, it is important that in patients who are elderly and have atrial fibrillation, we rule out cardiac amyloidosis so that we don't need to worry about added risk scores to understand the possibility of a stroke in these patients. In patients who may not otherwise be at high risk for a stroke with atrial fibrillation, presence of amyloid increases the risk of stroke. The presence and understanding of what the disease is for the patient is very critical so that they understand what is going to happen to them. Making the diagnosis of cardiac amyloid is just as important as treating it. The current medications for this disease are costly, but that should not deter us from making the diagnosis so that we may give a modicum of understanding to the patients regarding what their disease is all about. Thank you.